I'm here today to talk to you as a neonatologist about fetal pain. We've gone over the dating systems. It's very important to differentiate between the post-fertilization age and the last menstrual period dating. I'm here because it's easy for me to imagine these babies at 20 to 24 weeks post-fertilization age because they are my patients in the NICU. So at 21 post-fertilization age, for example, there's a 53% survival to discharge to home, published in June of 2009. This is another example, a chart showing the survival to discharge in Pediatrics 2010, post-fertilization age. At 20 weeks, only 6%, 21 weeks, 25%, and at 22 weeks, over half of those babies survived to go home. And our hospital data is very similar. The 22 to 24 week post-fertilization age data, 80% of those babies discharged to home. So these are some pictures of what the babies look like in utero. 14 weeks post-fertilization through 22 weeks post-fertilization. You can see the detail in the face. You can see the movements. The 4D ultrasounds that we have now are real-time images, the babies kicking, moving, sucking their thumb, doing all things babies do in a smaller state. A picture of a 20-week post-fertilization baby here. And these are my patients. This is that same infant when they're born and when we take care of them every day in our NICU. This is a 22-week post-fertilization baby. Very common 24-week LMP baby in our NICU. We take care of these babies all the time. They survive, they do well, and go home. This baby's 25 weeks by LMP. The survival rate is upwards of 85%. When we have a 25-week baby in our NICU, the assumption is the baby will do well, go home with mom. So when you look at the milestones of pain development, it happens early on. 8 weeks, face skin receptors appear. 14 weeks, the sensory fibers grow into the spinal cord. By 15 weeks, the monoamine fibers reach the cortex, and by 20 weeks, all the pain receptors are present and linked. The cerebral cortex at 20 weeks, the fetal brain actually has the full complement of neurons that are present in adulthood. At 20 weeks, you can do EEG recordings on the babies. At 22 weeks, we do EEGs on our patients, and the same EEG patterns that you see in a neonate born at term. There's behavioral responses as evidence for pain. At 8 weeks, the fetus makes movements. Again, we have 4D ultrasounds that show 3D images of babies kicking, moving, practically dancing in the womb. At 20 weeks, the fetus responds to sound, and many studies, published literature, have shown that they react to stimuli by moving away from painful stimuli, by wincing, recoiling, vigorous body movements. You can see it in real time. It's like watching a movie. There have been studies that look at the fetus when you can sample blood through the baby's liver versus sampling blood through the umbilical cord. And there's no neurons and no nerve tissue that the baby would sense pain from the umbilical cord. But when you take blood from a baby's liver, it feels it. It moves away from the needle, and the stress hormones of the baby, which are measurable, go up by 500%. So the hormonal response to pain in these babies, which I see every day, are identical between the fetus, the premature baby, and even the adult. The stress hormone response for a premature infant, again, rises upwards of 500%. The cortisol, just the same hormone that we can measure in adults, is approximately 200% increase. And this is beginning at 18 weeks gestation. We can measure this and have measured this and published it. When you look at neuropeptides in pain, the